Den 121 Dental Hygiene Preclinic Lab. Lab test, small ultrasonic units, denture, partial. You are the sterilization assistant today. How will you set up the denture ultrasonic when preparing for the day? Counters are clean from last night's disinfection process. By 9:30, there is a denture in the basket that needs cleaning. Describe how you will do this. Then show how you will break down the unit at the end of the day. Prepare unit and bags. The operator will have the bag ready. Have patient name and op number written on the outside of the baggie in marker. To fill with water to cover the denture or partial as soon as the patient takes them out of their mouth. Have the patient lower the denture or partial into the bag without contaminating the bag. Cover the denture with water. Operator will bring partial or denture to denture basket in sterilization room located beside the small ultrasonic unit located to the left of the clean sink. The outside of the bag will remain uncontaminated. Don proper PPE, which is gown, mask, gloves, and treatment gloves.
So I already have on my gown. I have on my prescription lenses. I'm going to put on a mask. I'm going to put on my overglasses. I'm going to sanitize my hands. Remember, anytime you come in and out of treatment gloves, you're going to either wash your hands or use hand sanitizer. Okay.
The sterilization student will fill Quantrex ultrasonic unit half full of tap water. Fill one or both of the beakers halfway with tap water.
I'm going to plug in the unit. Actually, the unit is already plugged in.
Okay.
And then I'm going to fill up the beakers.
One or both. But if there's a denture in each side, both need to be filled halfway.
So the first thing I'm going to do is actually fill up the unit.
Fill beakers halfway with tap water. 1 beaker per partial or denture. And sit the beaker or beakers into the ultrasonic unit. Get out a foil square to place to the right side of the dirty sink.
I'm going to use a foil square. They're kept over here.
Get a denture brush from the OHI cart. Remove from package and place on foil square beside dirty side sink. Save package to send brush home in. Get out additional baggies and label with patient's name and operatory number for later delivery to the operatory. Remember to open bag and place on clean side.
So the baggies are kept in the drawer, just up under the gloves on the clean side. So I'm going to label the operatory number that's on the denture bag that came in and the operator's name that brought me the denture.
Prepare dirty sink by placing a cushioning blue towel in the bottom of the sink.
Make sure you open up the bag. The reason we use a blue towel in the sink is just in case you drop the denture. This cushions it. Hopefully, if you drop it, it won't break if we put a towel down.
Pour water from denture bag into towel-lined dirty side sink.
Okay, so I'm just going to get my denture. I'm going to pour the water without contaminating my gloves.
Add tartar remover located under clean side sink into denture bag by pumping until contents are barely covered.
So the tartar remover is on the, you want to make sure you have a good grip on this. The tartar remover is under the clean side. This says tartar, stain, and cement. And I'm not going to actually do it, but I would pump until I just feel the denture.
If the denture is clean, do not use tartar and stain remover. Use a Polident tablet dissolved in water. Now you would zip baggie closed and place into beaker, making sure that partial or denture is completely down in water. Do not contaminate the outside of the bag at any time.
So remember, this would actually have tartar and stain remover or a Polident in it. So I'm going to pretend like it has a Polident in it. So I'm just going to fill it up with a little water. Place this down in the beaker.
With dry, clean treatment gloves, agitate denture or partials for 10 minutes. Turning knob.
So I'm going to turn this on. And that would go for 10 minutes.
While unit is running, you will now keep busy with other duties. Depending upon the task, you will either remove treatment gloves and wash, dry, sanitize hands, or continue working on the clean side of the room with these clean treatment gloves. To work on the dirty side with dirty instruments, you must be in nitrils.
So I'm going to just continue the competency with my clean treatment gloves at this point.
When small ultrasonic unit stops running, use treatment gloved hands to take baggies or baggie from ultrasonic beaker to lined dirty sink. Pour out the solution and carefully remove denture from bag. Drop bag in dirty sink.
I'm going to keep the denture in my left hand. I'm going to drop the bag in the sink.
Scrub denture gently under running water with clean denture brush to remove loosened deposits. Place scrub denture on the clean foil square.
So I am cleaning in the nooks and crannies of the denture, trying to hold on to it, having a good grip. So I would clean that. Okay, put the denture on one half of the foil.
Rinse off brush, shake lightly to remove water, and drop denture brush onto foil square to drain.
Gonna put it on the same side with the denture.
Remove dirty treatment gloves and then wash, dry, or sanitize hands.
So I'm gonna remove my treatment gloves. I'm gonna sanitize my hands.
With new treatment gloves from the clean side, retrieve the previously labeled clean baggie while holding the bag open with one cleaned hand. Use the other hand to place denture in bag.
So I'm going to use my left hand to keep this bag clean. Because keep in mind, our denture has not been disinfected. It has only been cleaned in tartar and stain remover. So I'm going to use my right hand to pick up the denture, drop it into the baggie.
Place clean denture bag on clean counter near sink. Remember which hand is contaminated from handling the denture. Hold denture brush packaging with non-contaminated hand.
And that was my left hand.
Use other hand to place brush into package.
So I'm just going to place the brush into the package.
And place package beside the clean dentures. Doff gloves and wash, dry, or sanitize hands
A lot of washing, drying, sanitizing hands, and dental hygiene.
for 15 seconds.
Okay.
At clean sink, add enough water to bags to cover denture. Then add a small splash of mouthwash.
I'm going to add a splash of mouthwash.
Deliver and zip baggie closed. Deliver clean dentures and denture brush in original package to proper operatory.
So I would take this to operatory 4.
Sanitize hands and don treatment gloves and nitrils. Remove baggie from sink and throw into trash.
I can also take the foil at this time.
Wring out blue cushioning towel before throwing into hamper.
And this is our hamper.
Nitrils can be removed and placed on the dirty sink, or you can continue to work on the dirty side. Okay. Cleaning unit. At the end of the day, with clean, treatment gloved hands, empty beakers into sink. Drain water from ultrasonic unit into the sink. Dry unit and cover.
Okay, so I'm going to empty the beaker. In order for the unit to drain, I'm going to put the hose into the sink and unclip it. And that will drain. While I'm waiting for that to drain, I can wipe the beaker dry. Because remember, we haven't had anything but water in here. So nothing has been put in here that has been contaminated.
Dry the unit.
Want to wipe up any water you drip. And that'll take just a minute more to drain. And I'm tilting that so the last little bit will get out. Okay, I've dried the unit.
Now you're going to put everything back in. Place cover on the unit.
Want to make sure that we have the hose clipped.
And unplug the unit.
You'll always want to make sure that anytime we're dealing with electrical, if we happen to have our wet hands at this point, we would make sure they were dry. Always want to make sure before you turn anything on or unplug or plug in anything that you have dry hands, and my gloves are dry at this point. We're unplugging the unit.